Hi everyone, it's Jamie Lesage, and I'm going to talk to you about the article I chose on Medscape called Evaluation of a Program to Improve Linkage to and Retention and Care Among Refugees with Hepatitis B Virus Infection. Now, hepatitis B virus can be very serious. It can develop it can lead to complications of chronic HBV infection that include liver cirrhosis and hepatocellular carcinoma. And this can develop in 15 to 25% of untreated adults that were infected in infancy or childhood. And this is found a lot, unfortunately, in our refugee population. And the reason why I chose this article was as we were learning more about refugees this week in our weekly module, and nurses should gain knowledge in this public health issue, especially with San Diego being a top destination for refugees. And patients with chronic HBV infection require lifelong monitoring to prevent the progression that can lead to end-stage liver disease and hepatocellular carcinoma. Also, October, which we just passed not too long ago, is National Liver Awareness Month. So the day, April 19th and October, are awareness months or days of the year so that we can be reminded of the liver and the problems that can come from the liver. The liver is something to be cherished and hopefully nourished and not taken for granted. It's the second largest organ, with the exception of the brain, one of the most complex, and it's very important. There's, I believe, over 400, some books say 500 vital functions that are done from the liver, completed in our body, metabolic processes. I mean, we're looking at clotting factors, it takes out toxins out of our blood. There's so many things it does. I could go on forever. And some interesting facts that I found, I know I was very interested in learning more about the liver and going back for my RN, especially with my boy dog having liver problems. And so it sparked my interest. 80 to 90% of the liver parenchyma needs to be destroyed before there are clinical signs of liver failure. And this is actually really sad. People say jaundice. Do we see jaundice? Well, a lot of times there's a lot of damage done before you're ever going to see jaundice. And by that time, there's been quite a lot of damage done to the liver. Clinical signs of liver failure may not present until 10 to 20% of your liver is still functioning. So you might not have these presenting symptoms of liver problem until you're already down to only 10 to 20% of your liver functioning, which is just astounding to me. Well, it's kind of a good thing because you can function pretty good with not very much of your liver. But on a positive note, it can regenerate completely as long as you have a minimum of 25% of the tissue remaining. And right now, I know for California, last time I checked, it's pretty challenging to get a liver transplant. Actually, my uncle actually did in California. He had a friend, a nurse, that actually helped him in that process, and we are forever grateful for that donor and for him. But it is very hard to get a liver transplant. So just wanted to bring that to your guys' attention. I'm going to include this interesting video that I used in nursing school. It's a Christmas song, but it talks about some of the different functions of the liver and some of the issues that go with cirrhosis. So just a couple minutes. So feel free to watch that, listen to that, and take care of your liver. Thank you. Bye.